diabetes can impair cardiovascular health and increase the risk of heart attacks, strokes, and even death. In this video, I review the science that shows how exercise can reduce all of these risks in diabetic patients. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. There are certain risk factors for cardiovascular disease that seem to be more prevalent in diabetic patients. These could be things like high blood pressure, obesity, and exercise has been shown to reduce these risk factors. In a meta-analysis of 34 studies, they found that aerobic exercise alone or combined with resistance training can significantly improve some of these cardiovascular risk factors, including systolic blood pressure, triglycerides, and waist circumference. Diabetic patients who do not do physical activity not only have a higher risk for these risk factors we just mentioned, but they actually also have a higher risk for having a cardiovascular event like a heart attack or a stroke. In a study of 938 Japanese elderly people with type 2 diabetes, and they were followed over the course of about 6 to 7 years. This study looked at physical activity throughout a week. It could either be leisure time physical activity, sports, or even those who had a physically active job. And then they broke them into groups from least active to most active, and they broke it into 4 levels. What they found was that the group that was a little active, group 2, had about a 20% reduced risk of one of these cardiovascular events like a heart attack or a stroke or peripheral artery disease. Those who were more active had about a 23% reduced risk of these events. And those in the highest physical activity group had about a 46% reduced risk of having one of these bad cardiovascular events. So this study showed that those people with diabetes that did more and more physical activity had a lower and lower risk of a cardiovascular event like stroke, heart attack, or a peripheral arterial disease. Now, another study that was performed in the United States had very similar findings. This was a study of women. So this was a study of about 5,000 nurses who were followed for 14 years. And they used surveys to determine how physically active people were, and this was moderate to vigorous activity per week. And they broke it down to, let's say, less than an hour, between 1 and 2 hours, between 2 and 4 hours, 4 to 7 hours, and more than 7 hours. And this study found that as the amount of exercise increased per week, the risk of a coronary heart disease issue had reduced. So those people doing exercise between 2 to 4 hours a week had reduced that risk by 14%. Between 4 and 7 hours a week had reduced their risk by almost 40%. And those who were doing more than 7 hours per week had reduced that risk by 50%. This study also found these same benefits for the risk of stroke. So again, for those people who were doing 1 to 4 hours of exercise per week had reduced their risk of stroke by 6%, and those who were doing more than 4 hours of exercise per week had reduced their risk of a stroke by a little bit over 60%. So far, we looked at exercise as it relates to risk factors for cardiovascular disease. We looked at exercise and the risk of having a cardiovascular event like heart attack or stroke. But now let's talk about physical activity and exercise as it relates to the risk of death in these patients who have diabetes. For example, here's a study that looked at the relationship of walking to the risk of death in U.S. adults with diabetes. And here they looked at almost 3,000 adults, and they followed them for over about 8 years. And what they found was diabetic patients who walked at least 2 hours per week had reduced their risk of death from any reason by 40% and had reduced their risk of death from a cardiovascular event by 34%. Now, for those people, as they increased walking, that gave even more benefits. So those people who were walking 3 to 4 hours per week have reduced their risk of death by 54% and have reduced their risk of death from cardiovascular disease by 53%. And again, this was compared to those people who were inactive. So this study shows the more activity and exercise a diabetic does can reduce their risk of death for any reason and also from cardiovascular disease reasons. This study is backed up by a meta-analysis that had over 150,000 patients. And this study showed that physical activity in diabetic patients may decrease the risk of death by about 43% and the risk of death from cardiovascular disease reasons by about 45%. Now, interestingly, this study showed that the reductions in all-cause mortality, meaning death for any reason, were more significant in diabetic patients who were older, more than 60 years, and for those who had higher BMI, those who are more overweight or obese. So this study shows that older people and those who are overweight have even greater benefits from doing physical activity if they're diabetic to reduce their risk of death. Let's wrap up this video and go over a few key points. Number one, exercise in diabetic patients can reduce risk factors for cardiovascular disease. Number two, physical activity and exercise in diabetic patients can reduce their risk of having a cardiovascular event like a heart attack or a stroke or peripheral artery disease. And number three, exercise and physical activity in diabetic patients can reduce their risk of death. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.